That's a really interesting question. The first part about the scientific literature has to do with the quality of life of people with chronic pain. There's been a good deal of research looking at quality of life using the same measurement instruments with people with different chronic illnesses, and it turns out that people with chronic pain have very low quality of life compared with others with very serious chronic illnesses, such as heart disease or diabetes or chronic pulmonary disease. So it's clear that chronic pain affects people quite significantly, and from that perspective, it's hard to see that there's a benefit to chronic pain. Although some people will tell you that they've learned a great deal, many important life lessons that have been a benefit for them. But overall, if people could trade in their chronic pain, they certainly would. So the second part of your question had to do with embracing chronic pain, and I think this is more a terminology issue, and it's hard to know what embracing pain really means. But the notion is that in order to really manage your chronic pain effectively, one needs to acknowledge that it's part of your life and then look for ways to manage it. The question kind of reminds me of a story of a woman that I treated some years ago who was maybe in her 50s and had a very bad knee problem. And she one day told me, I've begun to conceptualize my chronic pain problem as the rest of me is 50, but I have an 80-year-old leg, and I need to respect that 80-year-old leg and treat it kindly. So in that regard, perhaps that's embracing, but certainly it means that she's acknowledging that she has a problem and that her life will go more smoothly if she acknowledges it and looks for ways to manage to be kind to that 80-year-old leg. So I think whatever language you use, finding a way to acknowledge the problem and work with it is an effective way of beginning your journey with managing your chronic pain better.